Hi, my name is Dr. Coulter, and I'll now be discussing common medications for the nose. The first category isn't really medication, but over-the-counter saline irrigations. Saline is just salt water. Using this in the nose can help by keeping it moist and flushing out mucus and irritants. It's extremely low risk and may help a bit. Small bottles can be sprayed in the nostrils for moisture. Larger rinse kits typically require you to mix the salt packets in distilled, sterile, or previously boiled water. The small bottles are good to keep the nose moist and gentle for use after nasal surgery, but don't get to the sinuses as well. Larger squeeze bottles work better for sinus issues. It should be used as a power rinse by squeezing the solution up one nostril and then exiting the other, or out the mouth. You can do this leaning over a sink or in the shower. Neti pots are common, but don't quite work as well. There are newer power devices, such as Navage, that are convenient and work well, but more expensive. Next are topical steroids. Flonase is the most common spray. It's easy to use and works well if used regularly for allergies and sinusitis. For more severe cases, steroids can be added to sinus rinse kits for deeper application. There are newer delivery methods, including devices you can blow into or implants in the nose that deliver steroids. Although rare, a more common side effect is bleeding from the nose. To reduce this risk, spray the steroid away from the septum or midline of your nose. Spray it up and out by holding it in the opposite hand of the nostril you are applying to. There are also topical antihistamines. These are used for symptoms such as sneezing, runny nose, nasal itching, and congestion, such as allergies in the nose. The most common is called azelastine or Astelin. The downside is that it can taste bad. It can be combined with topical steroid spray. This is called Dymista. Next is topical anticholinergics, used for a runny nose. This can help dry out secretions. The most common medication is ipratropium or Atrovent. Topical antibiotics are sometimes used in the setting of recurrent sinus infections, despite previous sinus surgery, although can be expensive. Topical decongestants like Afrin can effectively make it easier to breathe through the nose, but are very addictive and shouldn't be used for more than 3 days consecutively. Everything I've reviewed is about topical or intranasal medications. Next, I'll talk about medications taken orally, usually as a pill. Let's talk about oral antihistamines. These are used for allergies. Older medications like Benadryl can make you sleepy. Newer medications generally do not, and all usually work well if taken daily. These are the four most commonly used, and have only subtle differences. Zyrtec works quickly, but can be mildly sedating. Claritin has a low cost. Allegra is completely non-sedating. Xyzal might work the best, but has a higher cost. Oral antibiotics are sometimes used for acute sinus infections. Oral decongestants, such as Sudafed, can be taken as a short-term solution to help relieve nasal congestion and sinus pressure, but should not be used regularly due to side effects. It can be used during a flight if you have issues popping your ears or get sinus pressure from pressure changes. Oral steroids have many potential side effects, but can be used in short bursts, especially for patients with nasal polyps. Leukotriene receptor antagonists, such as montelukast, are sometimes used for patients with allergies or sinus issues and also asthma. Expectorants like Mucinex are over-the-counter options that help thin out thick nasal secretions and also help with a productive cough. In general, saline irrigations and topical steroids are good for a majority of nasal conditions, with antihistamines added for allergies. Other medications are considered for severe sinusitis and more unique nasal conditions. I hope to discuss further details with you soon.